Good evening and welcome to the Ask Dr. Renee show here at Black Doctor. And first, of course, we have to always do housekeeping. Please share the broadcast. Sharing is caring. And there's some great information that's going to be disseminated today. We are celebrating something, so I want to make sure that no one misses out. So please make sure that you share the broadcast. So I don't care where you're watching, Facebook or YouTube, make sure you share this broadcast so that someone else that may need this information can see. Also, please let us know where you're watching from. We love to find out where our viewers are coming in from. So please let us know where you're watching from. That would be awesome. And lastly, if you're watching the replay, still feel free to share because people still need the information. This is going to be some great information. And I'm sure you read the topic and was like, what is that? And so that's why you need to make sure. And really, I want parents that have teens, tweens, you might want to share this with your children and have them watch this with you. So just a little FYI. So today, everyone, I wanted to let you know that today is National Black HIV/AIDS Awareness Day. So that's what we're celebrating today. So here we go. I'm going to bring my guest on in a second. But good evening and welcome to, like I said, the Ask Dr. Renee show here at Black Doctor. According to the Centers for Disease Control and Prevention, share that Black Americans account for approximately 14% of the U.S. population, but close to 50% of new HIV diagnosis annually. So tonight, as we join millions across the globe to honor National Black HIV/AIDS Awareness Day, we are having a real talk about Black folks, PreP, and prevention. And to get us going, I am so pleased to welcome Dr. Hyman Scott. Good evening.
Good evening. How are you?
Great. How are you?
Me.
Oh,
I'm doing well.
I'm so excited. I've heard great things about you, so this is going to be amazing. So Dr. Scott is an MD and also has his master's in public health and is the clinical research medical director at Bridge HIV in the San Francisco Department of Public Health and an assistant clinical professor of medicine at UCSF. His research focuses on implementation of HIV prevention clinical trials, understanding racial ethnic disparities in HIV acquisition, and using technology to expand uptake and use of HIV prevention interventions. He is active with several research networks, including the HIV Vaccine Network, COVID-19 Prevention Network, and the HIV Prevention Trials Network and Adolescent Trials Network. Welcome again. And so I'm so excited, but we have limited time and we have a lot of information I really want to get because I know that there's so much new stuff and I want everyone to know what's going on. So first, let's start with what is PreP?
So that's an excellent question. I get asked that all the time. So PreP stands for pre-exposure prophylaxis. And it is essentially taking a medication before you are potentially exposed to HIV to prevent sort of an HIV infection from happening. So there are a couple of different types of PreP, and we have PreP in other for other conditions as well. If you travel, for example, you might take a medication for malaria, and so in this case for HIV, it's there's a pill that someone could take, and some people can take it every day, and there's other folks that can take it just around the time that they need it, but it's taken before sex, for example. And now we also have recently approved an injection. So there's a shot that is given. The first two are given 1 month apart, and then all the other shots are given every 2 months. So in that scenario, there is no pill that's necessary to take every day. And it's got it works really, really, really well. So we're talking upwards of 99% in preventing HIV infection. So we have these really powerful options for people to stay safer from HIV and for HIV prevention.
And so I just have to throw this in there. So these are those commercials you guys have seen. Like I saw, didn't know what they were talking about, but they were always like having a good time.
Yeah. And it's exactly right. And I think that there's a desire to talk about it in this sort of way. These are pharmaceutical commercials,
right?
But talk about it in a way that doesn't stigmatize it. And I think that whether they hit the mark or not, I think the idea is that it's really to help people feel like they're in more control of their sexual health. And so that's how we sort of think about it. It's not just about, negative things or stigmatizing it, but just talking about people taking control of their sexual health.
Yeah, so when you hear PreP, you'll know what they're talking about in the commercials, because they'll say that, and you'll see, and they have all sorts of different drugs on the market. So does PreP just protect you from HIV or any STI? Sexually transmitted infection, for those that don't know.
Yeah, so HIV PreP is only for HIV. It doesn't provide you with protection from other STIs. We have other tools, actually, which I'm happy to talk about, that help provide some protection from the bacterial STIs. But for PreP, when we're talking about PreP, it's just for HIV. And we want people to get tested and talk to their partners and have a healthy, vibrant sex life. And PreP is for the HIV prevention part of that.
Awesome. So if you start using PreP and then you're not sexually active, can you get off of PreP until you're active again?
Yeah. Okay. So absolutely. It's really a tool that you can use and tailor for what works for your life. And so what we generally say is, it's for the seasons of risk. So the times in which you might have, sex that might lead to an exposure to HIV. But I also live in Northern California, and sometimes it's always spring for people. And so keeping it available and on board, so that even if the flowers bloom unexpectedly, that you're ready to stay safe, to stay safer. And so we really try to encourage people to think about it, in that terms, and having it as a tool that you can have on hand to use when you need it, even sometimes when you might not expect that you need it.
I like that. It's spring all the time. I love that. That was cute. So using PreP, one might think, oh, well, I don't need to use condoms because I took PreP. But that's probably not the best of ideas.
Yeah, so the condom discussion is actually, fraught with some potholes in it, I would say. So condoms are absolutely a tool that people can use if they feel comfortable with it. But we know that not everyone uses condoms, and not everyone uses condoms all the time, and not everyone uses condoms even all the time during a single sexual encounter that they might have. And so we want to, sort of meet people where they are. Give them the information, but also we defer to people to have autonomy to make their own choices. Their choice about condom use or not is going to be their choice. It might include their partner in that discussion. But in the absence of a condom being used, this is a good tool to prevent HIV. And so let people choose and decide what they feel comfortable with, what works for them. Because if we try to force them into something that they don't actually want, we know what's going to happen. They're just not going to use it. And, we're not going to be there.
Let me be the disclaimer that condoms protect from herpes and some other, STIs that you might be exposing yourself to. So PreP got you covered for HIV, but condoms will have you covered for other things: chlamydia, gonorrhea, et cetera, et cetera. So
yes, yes, I think we pass out condoms, and, I think condoms and lube, we actually, because condom breakage is reduced if appropriate lube is used for certain types of sex. And so absolutely, we make condoms available. But we also want people to know that, they can make a choice, that condoms do have these other advantages for other STIs. And for some people, that's enough for one to be used.
So, so then, of course, is the tricky question, and this is where that commercial really got me. So, is PreP just for men who sleep with men, or can some gender-loving women, or how does it work?
So what I say is PreP is for everyone.
Okay.
And that's the end of the sentence for me, because it really is. It is for everyone, and I think how we talk about it, I think HIV was also thought to be just among gay men. For example, early on, and we know that there was an epidemic that was spreading among women as well, and individuals who inject drugs, and so there's a variety of things that our society projects onto this that I think is reflected in some of these. So a lot of the ads have been focused on, gay men.
That's what I was gonna say to you. There was an
Yeah.
ad, the one ad that I remembered, the first one I think I saw was like, you must be, it said specifically, you must be something in order to take this. I can't remember, but it was very specific.
Yes.
Yeah.
And I think that specificity caused two problems. One, it didn't reflect what we now know is from the data is that, for oral PrEP with tenofovir based PrEP, that, we have studies across all the types of sex that someone could potentially have, and it works well to protect people. And then for injectable PrEP, the same thing. We have really good data that it protects, with all types of sex that individuals are having. And so now the ads and the advertisements are going to be decisions that are made by people who are making those ads. And it does reflect what we see. You mentioned the epidemiology of who is acquiring HIV. That is, if you look at disproportionate, like who is impacted more than they represent the population, it is among gay men. That is not to exclude, but it's not 100%. And we have cisgender women and trans women and trans men who are also acquiring HIV, and non-binary individuals that also need this prevention and also shouldn't be excluded. And I think that we need to do a better job of making sure that everyone knows that this is available for them. So when I talk to people, I say that PrEP is for everyone who wants to take control of their sexual health in ways to prevent HIV.
I like that. That works. Because when I tell you that first one, I know what it said. It said it's for persons born male or something like that. It said that first commercial. And I was like, oh. And so I was like, okay, well, I guess it's not for everybody. Okay. Because in the commercial, there was some trans women in the commercial. And I was like, I see what they're saying. But I was like, I guess it's only for guys then, or, people with penises, I guess. I don't know. But yeah, that was what threw me. That first commercial, that first series, I guess that was a while ago when it first came out. But like every drug in America, I'm sure that this is not a cheap fix. So if you don't have insurance, you're underinsured, what can those people do to get PrEP?
Yeah, so we have several programs, and some of it depends on what state you live in.
Okay.
But what's really wonderful, actually, more recently, is that the oral version of PrEP, so the pill that you take once a day, that actually recently went generic, and so now there's generic manufacturers. So some pharmacies, if you pay out of pocket, the whole bottle for a month is like around $30. It might be less.
Oh, that's not bad.
Yeah, and so
like
there's what's that?
That's like $1 a pill.
Yeah. And so, I think that that's really opened the door for people for whom, the cost is a barrier. We still want people to get tested for HIV and for STIs and to, have the other tests that they need to take PrEP. But, the injectable versions and the version of oral PrEP that's not generic is very expensive. There are patient assistance programs that help people cover the cost. But it's real. I mean, I have had patients who go to the pharmacy and, are told that they have to pay $1,800 or something like that. And, and they walk away. And, unfortunately, I have had a patient for whom that happened. And then, they were diagnosed with HIV 3 months later. And so it really was, those are sort of, for me, never events. Like that's something that should never happen.
Right.
And so what I think our systems and our support really needs to help people get on PrEP and stay on PrEP if that's what they want. And so that, because it works so well, like we don't have a vaccine yet, but we do have these very powerful medications that can prevent HIV.
Right. And then you just said something and I forgot what I was going to say. So I want to stress, you can't just walk into the pharmacy and say, I'd like to have PrEP. You do have to be prescribed this, correct?
So in California, you can. There's actually yesterday there was and this is again some of the policy changes. So there was a new law that was just signed by the governor yesterday called SB 339, which allows pharmacists to administer PrEP and to manage PrEP in the pharmacies without going in to see a primary care provider necessarily. And so, I think there are states that now have this. opportunity where the pharmacists can actually do the management and start people on PrEP. Pharmacies are more distributed than a lot of providers that offer
Right.
PrEP. And so provided that those pharmacies do that, it might be more accessible for some people.
So I when you said that, I just thought of a lot of people don't know that birth control is supposed to be for free for everyone if you have insurance, which is so shady. But if you have insurance, so you can actually use a lot of these apps, these telehealth apps. You never even have to talk to the doctor, and you can get the birth control mailed to you. And it could be condoms, it could be male condoms, female condoms, it could be birth control pills, whatever, and they will mail it to you. And so, like I said, many people don't know that, but this sounds like this could move in that direction if, the country gets on board, per se. Because I know the birth control thing is not per state. It's like, that's just the way it is.
Yeah. And so PrEP is also available through some of the telemedicine providers. So there's several telehealth providers that provide PrEP. And it does have a grade A recommendation from the U.S. Preventive Service Task Force, which by ACA law does require insurers to cover it without cost sharing. So in theory, PrEP should also be covered without cost in the same way birth control is. We know that is not always the case for everyone, but when we do challenge bills that people get, people do get those refunded. And so it is something that is covered as a really highly recommended prevention strategy. And the CDC in 2020 to 2021 guidance changed the recommendations from these very sort of risk-based to that everyone should be made aware of PrEP and should be provided PrEP if they want it, and give the education about the options that they have available for them and sort of what coverage they might have with their insurance. But it is now supposed to be a universal offer and education for PrEP for people.
And how can one determine if they should be taking PrEP? Just like you said, we don't want to say only, gay men or only. So we don't want to say only. So how can just, 21-year-old lands on campus, in college, how can they decide if they should get on PrEP?
Yeah, so it's always a personal decision. I think it's similar for birth control, right? We talk about, should you be on birth control? And that's a personal decision about it. What I say is that, if you're having condomless sex, then there's a risk of, HIV that can be there. And even if it's just one person, there's if that person has other partners or, isn't aware that they have HIV, then that risk could be there as well. So there's negotiated safety that that folks have with their sexual partners. But if someone is having condomless sex, that's generally enough for me to know that I should have a conversation with them about PrEP. So I don't really need to get into the number of partners and the types of sex that someone is having to know whether they're PrEP eligible. I do it for other reasons in terms of counseling and discussions around sexual health and testing. But for the PrEP discussion, really, it's like if you're having sex without a condom, then, that's enough. And then someone can make a personal decision if they want to take a medication every day or take a shot for HIV prevention.
Sounds good. And one of our viewers asked, what are the side effects?
Yeah, so that's a good question. So the side effects primarily from the oral version of PrEP is many people, when they first started, get some GI symptoms. So like an upset stomach, a little bit of bloating, a little nausea, very rarely diarrhea. Usually goes away within a couple of days and often goes away completely if they take it with food. There's a very low risk of kidney problems. You've probably seen some ads on social media about lawsuits around the kidney problems, but they're extremely rare, like around 0.6% of people have kidney problems that lead to something that they have to do, like stop the medication. And it can lead to a small decrease in the sort of density or thickness of the bones. And it's a small percentage of change, and then it goes away when the medication is stopped, and doesn't lead to a fracture. Like people don't have broken hips from from these changes that can happen. And then that's those are the main things that people experience. with with the oral version of the medication, and those are generally mild. And there was actually an analysis that looked at the side effects of oral PrEP compared to the side effects of aspirin, and they're about the same. So this is as safe as aspirin. Is a good way, I think, of talking about it, which you can buy over the counter and people take very easily. So that's to give you a perspective on how safe this oral PrEP version is. And then for the injectable version, it's an injection in the muscle. It's in the butt cheek. And so it comes along with some pain from that injection. Some people get nodules, like some swelling, some tenderness. Generally lasts a couple of days and goes away. And those are generally the side effects that people have from those two types of PrEP.
Okay, not bad at all. I like the comparison to aspirin. That's pretty good. So let's be honest. Are Black people actually using PrEP?
I would say if you look at the numbers and the proportion, the short answer to that is no. And I think the other question is, why not? Is it because Black people don't want PrEP, or is it because our systems and structures are set up that it makes it really hard for them to get PrEP? And I think it's the latter. We see this with, everything around, new medical advances. Oral PrEP has been around for more than 10 years. But there's a lot of structural barriers that Black Americans experience that are different than the other Americans are experiencing, to say the least. And so a lot of it has to do with provider access, insurance coverage, and sort of ability to access these new sort of prevention options as they become available. And then a lot of what we've seen locally, so I'm in San Francisco, we have a community sort of norm around PrEP that has shifted because so many people are on PrEP. And so I think that and we saw this during COVID, like people listen to their friends and family around recommendations more than they listen to probably anyone else. And so once you have sort of a key threshold or a number of people who are on it, there's just an expectation that like you're using or know about this, intervention with PrEP, and that just hasn't permeated all the places in our communities that I think it needs to, because it's hard to get. Sometimes the cost can be high. Providers might not be willing to offer it, in a variety of things. We did have a provider locally, this is several years ago, in San Francisco, who told one of our participants in one of our studies that, they weren't going to offer PrEP because they believed in monogamy. And so those are sometimes the things that get projected onto people when they're asking about something that is like, being proactive about trying to access.
Right. So the doctor kind of messed things up. Yeah.
Yeah. And, I think in the community too, like when people might talk about it, I think talking about sex and talking frankly, and, even if it's not explicitly about sex, but honestly about it, comes with some strings in certain communities. And, it's not always as easy to have those types of conversations, particularly when you're taking a medication to prevent HIV, which is, also highly stigmatized. And so I think there's a lot of layers there, but when we've done surveys and talked to people, the Black folks that are in those surveys want PrEP at the same rates that everyone else does. It's not like there isn't a desire for it.
So do you guys see a greater use among Black men or versus Black women, or vice versa?
I think it's more use among Black men. We definitely see more use among men in general. So there's just more men on PrEP than there are women, cisgender women and there's more cisgender men on PrEP than cisgender women on PrEP in the US. And that's true for Black folks as well. And so for that reason, we have a lot more Black men on PrEP than Black women when we look at who's actually using it. Overall, the numbers are really low though. No one is meeting our, we have goals of ending the epidemic in the United States to reach 50% coverage of people who might be eligible for PrEP. And we're so far behind that goal. It's, it is not a surprise, unfortunately. It is, somewhat disappointing that we haven't been able to think about the ways to get to that goal. in my opinion, we could have known that this was going to happen because this has happened with so many other things, and that the countermeasures that we needed to put in place at all the different levels to make sure this didn't happen. So in the most recent data from CDC, white Americans who are, have already exceeded that threshold of 50%, whereas Black and Latinx individuals have not. They're far, far behind.
I see. So do you guys, so in your studies also, have you found that people are staying on PrEP, or those that go off, are they coming back?
Yeah. So so a lot of people are going off PrEP. When we look at different studies, it's anywhere as low as like 30% of people stay on it for 6 months or a year. And so a lot of people are starting it and then they're stopping it. It's not necessarily because they have, their risk has changed, like the season necessarily hasn't changed, but they might have insurance changes. They might have a job change. They might have moved. They might have had one or too many hassles to be able to get it. So, if you otherwise are healthy and not sort of engaged in healthcare, this might be the main or the primary reason that you're going to see a provider. So now you have to go in for testing every 3 months. You have to go into the pharmacy, get the refills for the medications. And for some people, there's this hassle factor, which we say is like, keeping them out of, staying on PrEP over time. And so we try to remove that hassle factor as much as possible. But our healthcare systems are not set up to necessarily be that way for people. And so if you're otherwise healthy and, are sort of on the fence to begin with PrEP, then dealing with all that might just be too much and people will, not continue it. So we see that a lot. And, we also see people making a decision to restart it. So having gaps in their PrEP, 3-6 months. But, last month we had someone who was on PrEP last summer, stopped it for 3 months, came in to restart it, and we diagnosed them with HIV. We had a 21-year-old recently who stopped PrEP for 2 weeks, then had what we think was acute HIV symptoms about 6 weeks later. And so, when people stop PrEP, that doesn't mean that they're, not having sex anymore. They just don't have the protection that they had before. And so we see that, frequently enough that we try to counsel people about it. So I really encourage, try to encourage people to, to think about ways that we can help them stay on PrEP, and talk to their providers or talk to their navigators about, what they're experiencing to try to help them stay on it, because we are seeing that, quite frequently when people stop PrEP, that they come back to restart and are diagnosed with HIV.
That's awful. So now I'd like to talk about how the community can be more supportive of education and support of PrEP usage among Black Americans. So, we love our churches. Through the Black faith institutions, sometimes they get a bad rap around addressing HIV in a supportive, healthy way. For faith institutions that are doing the work, what can they do to create more awareness on PrEP and it being an important tool in the toolkit?
Yeah, so I think that some of the churches, particularly those that have like AIDS ministries, have congregations and ministers that are comfortable talking about the ideas around HIV prevention, which do involve sex discussions, some discussions around drug use as well. And so I think one of the things is, and we've had some faith initiatives here locally. And it's been amazing to talk to the clergy as they sort of learn the new language of how to talk about things in a way that fits also within, their work. And so I think that that's one of the first steps, is making sure that, that folks have the language and that have the opportunity to discuss it in safe spaces, in a way that is also in line with their, beliefs. So not trying to just challenge everything, but help and support the clergy and congregations to have these types of discussions that are non-stigmatizing, that don't, stigmatize or vilify individuals, based on sex and the type of sex that they're having. And in that way, I think within the churches, we can have these discussions in in safe ways that people can feel comfortable discussing it, that if it's not someone who's present in the church, but like the child, the nephew, the uncle, who might also benefit from having their network of people supportive of PrEP and know about PrEP and those kinds of things. I've definitely talked to some parents who have talked to their kids about PrEP when they haven't brought it up. Their
Right.
kids are a little freaked out that their parents are bringing up sex with them, but I think it's also healthy that
Exactly.
that's that you care about something, like
We used
it's
to watch
something you are.
90210, and my
Yeah,
mother watched it with us. In Beverly Hills 90210 for those of a certain age. And we would watch it. My mom would watch it with us. And so that's how she would bring up and have these conversations
yeah,
because, those kids, they were in high school, but they were doing all sorts of wild things.
yeah,
And so that's how she would bring it up. She would talk about it that way. And, but I think the other thing with the faith leaders is just like I, a physician, did not quite know what PrEP was until the first time I had a conversation about it, which was probably like 5 or 6 years ago with a pharmacist out of Florida that AHF connected me with. But that just like I didn't know, I wouldn't know how the faith leaders would know exactly what it is besides what they saw in the commercials too. So I think it's important, that we educate them so then that they
yeah,
can, trickle it down. Just like we had to do with COVID. We had to explain this is what it is, this is the vaccine, so that they could just get the information then out to their parishioners and congregations. So yeah, I think it's a very, 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 very forward thinking church that would have an AIDS or HIV ministry. But for those that do, I think that it's important. And then even if you have a singles ministry, I mean, you can have your blinders on, but face the facts and know that somebody in that singles ministry is having sex, and you should probably have these discussions to help them out. And that's why at the beginning of the show I did say parents, because I have a couple friends who are physicians who get hired by parents to talk to other people's children about sex because they just can't do it.
yeah,
Just can't do it.
yeah. And I think that's fine. I think it's like,
Me
as
too.
long
Do
as
something. Yes.
as long as it's done right. It doesn't have to be like we hire people to help with other things in our lives,
Exactly.
right? Like we should normalize that as just like the way that it needs to be done and ensure that it happens. And
I met a guy on a dating app. This had to have been 10 years ago. And he had a child. And I was like, and we were talking, and I was like, so how did you end up with the kid? And he's like, well, my mother never talked to me about sex. So I didn't know I didn't know that that's what would happen. And I was just stuck. Because, I mean, I'm 47. So this person was like 36, 40 years old.
yeah.
What?
Yeah, we make a lot of assumptions about where people are, and not
Right.
everyone is in the same place. And I think giving people the grace around, like, that maybe there was some missed education opportunities.
Right.
And I think it's particularly with what's happening in many of the school systems, and pulling out all this education
Yep.
happening in the schools, like that's going to just set us back even further.
I did a campaign about, because I didn't even know, because I don't have children. I didn't know that they were removing sex ed from the schools. And I was like, what? I go, that's ridiculous.
Yeah. But it's, it's happening in very populous states too. Like, this is not just, these are very large states that are changing these laws. So I think that the education, we can't, I can't emphasize that enough. I can't emphasize that enough, that I think, it's not that I think folks are wanting this information in a way that, they can use in their work. And we just have to be willing to take the time to do that education. And I think COVID was a very good example, as you mentioned, about, you gotta go to where people are. You got to use the language that is appropriate in those settings, and the messenger matters. And I think we need to ensure that the messengers are also individuals who can have that discussion in that language. I think, and particularly for Black folks, we went to see The Wiz last night in San Francisco, and there's just some things that happen that Black folks immediately got in the play, and I think there's these cultural aspects that sometimes ease the communication. It's not that it's absolutely necessary, but it does help in certain situations. And so I think that using those things and using those tools is not anything new and anything different than we do with other types of education and outreach efforts. But we have to have a concerted, continual effort on HIV prevention. And the landscape is changing. Like 15 years ago, we weren't talking about PrEP. Like that wasn't an option. And now we have 4 different regimens that we can offer people, including pills and injectables. So, I think when we get to a place where we might have a vaccine, there's going to raise a whole nother set of questions. And we just have to help people come along with us and provide the education, provide the resources, and not, stigmatize if they're unaware or if they have conceptions that are not quite right. Because there's a lot of, misinformation that doesn't get challenged in a lot of different ways. And, there's not always the opportunity to talk through things. We saw how quickly this stuff spreads when the COVID pandemic happened. But, the same social media channels allow everything to move in ways that, are not necessarily reflective of the truth.
Yeah, and I thought of the other vaccine that we did get was for HPV, human papillomavirus, and that didn't go well. And so, we would like this to go much differently than that. What do you say to the faith leaders that want to learn more? They need support. Where should we send them? What do we do?
Yeah, so there are, several groups. There's an initiative actually within the HIV Vaccine Trials Network to provide some of this education. There are local providers, I would say, trusted providers locally. I do really like the idea that people are like within the community spreading this information and sharing that information. But then there are national groups as well that can help with connecting for resources, for questions. I talk to providers and clergy and some of the groups that I'm a part of. And so there are providers, advocates who would be resources for answering those questions, providing support, and making sure the correct information is available for HIV prevention, HIV care, treatment, sexual health discussions, all of those things.
This has been amazing. I think that everyone that has watched and will watch is going to learn a lot. So as we close, what is one final thought you would give to Black Americans as we look at PrEP usage and it as a critical tool in the prevention toolkit?
So my last, I guess, thing I want everyone to know is like that PrEP may be for you, that it is for everyone. And we want to make sure that if it's something that you are want to know information about or want to be on, that there are ways to help you get it, either the information or the medication for HIV prevention. It is works extremely well. It's extremely safe, and we want to make sure everyone is aware of it as an option that they can make a choice about using or not.
Thank you again, Dr. Scott, and a continued thanks to our collaborating partners, the HVTN Faith Initiative and the Black Leadership AIDS Crisis Coalition, powered by AHF. And we'd like to hear from you. So as we continue to get out more information about HIV and AIDS and making informed sexual health decisions, let us know what you'd like to learn more about. So you can send me a note. You can send it to info@askdrrenee.info. You can send it through my Facebook page. You can go to my website, askdrrenee.info. But, if you have questions, let me know. If you have no problem, put them right here in the chat, and we will check it. I'll check it myself and make sure that your questions get answered. Also, next month is March is Women's Month, and so we will be talking about women and girls and HIV next month. So please make certain that you do stay tuned to Black Doctor. We always have great, engaging conversations, and I will see you next time.